PowerPoint will help you prepare for the written state CNA exam. I want you all to study hard so you can pass the first time. So let's get started. There will be questions that ask you, what is the right thing to do? Always remember to put the resident first, respect his or her rights. Always choose the answer that is professional, honest, that shows that you work hard. It's okay to ask for help if needed on the job. Communication is always a good thing, and you need to know what is within your scope of practice. What are the things that you are allowed to do as a CNA? So let's get started. Which of the following is a right that is included in the resident's Bill of Rights? A, to have staff available that speak different languages on each shift. B, to have payment plan options that are based on financial need. C, to have religious services offered at the facility daily. Or D, to make decisions and participate in own care. The correct answer is D. A, B, and C are all nice things to have at a facility, but D is the only right. It is a right that is protected by the law. Residents have the right to make decisions and participate in own care. This also has to do with resident rights. When giving a back rub, the nurse aide should A, apply lotion to the back directly from the bottle. B, keep the resident covered as much as possible. C, leave extra lotion on the skin when completing the procedure. Or D, expect the resident to lie on his or her stomach. The correct answer is B, keep the resident covered as much as possible. The CNA should always respect the client's right to privacy. Which of the following is a job task performed by the nurse aide? Participating in resident care planning conferences. B, taking a telephone order from a physician. C, giving medications to assigned residents. Or D, changing sterile wound dressings. The correct answer is A, participating in resident care planning conferences. We know that B, C, and D are all outside the scope of practice of a CNA. Which of the following statements is true about range of motion exercises? A, done just once a day. B, help prevent strokes and paralysis. C, require at least 10 repetitions of each exercise. Or D, are often performed during ADLs such as bathing or dressing. And the correct answer is D. They're often performed during ADLs such as bathing or dressing. A few minutes before the end of the shift, a resident calls and whispers to the nurse aide, "I had an accident. I wet myself." What should the nurse aide do? A, explain that the next shift will assist the resident in a short time. B, remove any wet clothing and place the resident on a dry underpad. C, ask if the resident feels very comfortable. Or D, provide incontinent care to the resident. And the correct answer is D. Many students said B, remove any wet clothing and place the resident on a dry underpad. That is not everything that you should do. When you provide incontinent care, you remove the wet clothing, you clean the resident, and you make them comfortable. So B is not complete. What you would do is provide incontinent care to the resident. The nurse aide receives resident assignments from the charge nurse at the beginning of the shift. When planning priorities, it will be most important for the nurse aide to A. Decide break times with other nurse aides. B. Review assignments with others to check if residents are divided evenly. C. Check all assigned residents to see if anyone has immediate needs. Or D. Check what the activity department has scheduled for residents during the shift. Keyword is most important. The most important thing to do is check all assigned residents to see if anyone has immediate needs. A nurse aide who is new to the unit observes two residents go into a room and close the door. The nurse aide suspects that the two residents are going to have sex. What should the nurse aide do? A. Check on the residents every few minutes. B. Report the resident's behavior to the charge nurse. C. Ask the nurse if the resident should be medicated. Or D. Tell the residents that sex is not allowed in the nursing home. The correct answer is B. Report the resident's behavior to the charge nurse. As the nurse aide begins his or her assignment, which of the following should the nurse aide do first? A. Collect linen supplies for the shift. B. Check all the nurse aide's assigned residents. C. Assist a resident that has called for assistance to get off the toilet. Or D. Start bathing a resident that has physical therapy in 1 hour. The correct answer is C. Assist a resident that has called for assistance to get off the toilet. This is similar to the question that asked about the most important thing at the beginning of a shift is to check for immediate needs. And getting off the toilet would be an immediate need. Which of the following would affect a nurse aide status on the state's nurse aide registry and also cause the nurse aide to be ineligible to work in a nursing home? A. Having been terminated from another facility for repeated tardiness. B. Missing a mandatory infection control in-service training program. C. Failing to show for work without calling to report the absence. Or D. Having a finding for resident neglect. The correct answer is D. The state's nurse aide registry will only have very serious findings, such as neglect or abuse. Oops, and this one is out of order, but we're going to skip it. When a resident's husband begins telling the nurse aide how to care for his wife, the nurse aide should A. Accept that the husband has always been in charge. B. Explain that the nurse aide is certified and able to care for his wife. C. Suggest that the husband participate in his wife's resident care conferences. Or D. Understand that the husband wants staff aware of his wife's needs. The correct answer is D. Understand that the husband wants staff aware of his wife's needs. Which action is most helpful to decrease a resident's incontinence? A. Leaving a bedpan in place for extra time. B. Putting an incontinent brief on the resident. C. Answering the call light quickly. D, controlling fluid intake throughout the day? Correct answer is C, answering the call light quickly. A resident gets dressed and comes out of his room wearing shoes that are from two different pairs. The nurse aide should A, tease the resident by complimenting the resident's sense of style. B, ask if the resident realizes that the shoes do not match. C, remind the resident that the nurse aide can dress the resident. Or D, ask if the resident lost some of his shoes. And the correct answer is B. This is the answer that lets the resident have dignity. Ask if the resident realizes that the shoes do not match. We don't want to tease, that would be the wrong answer. And the nurse aide should let the resident dress themselves if they are able to. Correct answer is B. All right. As you take this test, remember to choose the answer where you stay calm and professional. Let's look at some examples. Okay. When a resident is combative and trying to hit the nurse aide, it is important for the nurse aide to A, show the resident that the nurse aide is in control. B, call for help to make sure there are witnesses. C, explain that if the resident is not calm, a restraint may be applied. Or D, step back to protect self from harm while speaking in a calm manner. The correct answer is D, step back to protect self from harm while speaking in a calm manner. During lunch in the dining room, a resident begins yelling and throws a spoon at the nurse aide. The best response by the nurse aide is to A, remain calm and ask what is upsetting the resident. B, begin removing all the other residents from the dining room. C, scold the resident and ask the resident to leave the dining room immediately. Or D, remove the resident's plate, fork, knife, and cup so there is nothing else to throw. The correct answer is to A, remain calm. A CNA remains calm and asks what is upsetting the resident. Okay, this is when you don't know what to do. It's okay to say you have a lack of experience. It's okay to ask for help. But do not do a job you don't know how to do, and do not ask another nurse aide to do the assigned task. Let's look at some examples. Okay, here the job is to change a urinary drainage bag. A nurse aide is asked to change a urinary drainage bag attached to an indwelling urinary catheter. The nurse aide has never done this before. The best response by the nurse aide is to A, change the indwelling catheter at the same time. B, ask another nurse aide to change the urinary drainage bags. C, change the bag, asking for help only if the nurse aide has problems. D, ask a nurse to watch the nurse aide change the bag since it is the first time. The correct answer is ask a nurse to watch the nurse aide change the bag since it is the first time. A nurse aide is assigned to provide post-mortem care for a resident, but has never done this procedure before. Which of the following is the most appropriate response by the nurse aide? A, ask another nurse aide to trade assignments. B, provide the care since the resident cannot be harmed. C. Talk to other nurse aides about how to perform the procedure. Or D. Discuss the nurse aide's lack of experience with the nurse. The correct answer is D. Discuss the nurse aide's lack of experience with the nurse. I mean, speaking to the nurse and saying, I have a lack of experience. I don't have experience with postmortem care. All right, always listen to the resident. There will be questions on the test where the correct answer is listen to the resident. Let's look at some examples. And these are the phrases you might see. Listen to the resident. Allow the resident to talk. Focus on the resident. Show empathy and understanding. And ask open questions. Open questions are not yes or no. They are not questions that have a yes or no answer. Open questions allow a resident to talk. Let's look at some examples. How should the nurse aide respond when a resident tries to talk about the recent death of another resident? A. Explain that HIPAA laws forbid staff from discussing residents that died. B. Suggest the resident talk to other residents feeling the same loss. C. Try distracting the resident with a more cheerful subject. Or D. Allow the resident to talk about the resident that died. The CNA should always allow the resident to talk. Correct answer is D. Allow the resident to talk about the resident that died. A resident's wife recently died. The resident is now staying in his room all the time and eating very little. The best response by the nurse aide is to A. Remind the resident to be thankful for the years he shared with his wife. B. Tell the resident that he needs to get out of his room at least once a day. C. Understand the resident is grieving and give him chances to talk. Or D. Avoid mentioning his wife when caring for him. The correct answer is C. Understand the resident is grieving and give him chances to talk. When a person is admitted to the nursing home, the nurse aide should expect that the resident will have problems related to incontinence, require a lot of assistance with personal care, experience a sense of loss related to the life change, or D, adjust more quickly if admitted directly from the hospital. And the correct answer is C. Experience a sense of loss related to the life change. When a resident is expressing anger, the nurse aide should A. Correct the resident's misperceptions. B. Ask the resident to speak in a kinder tone. C. Listen closely to the resident's concerns. Or D. Remind the resident that everyone gets angry. Correct answer is listen closely to the resident's concerns. This is about open questions. Which of the following questions asked to the resident is most likely to encourage conversation? A. Are you feeling tired today? B. Do you want to wear this outfit? C. What are your favorite foods? Or D. Is this water warm enough? The correct answer is C. A, B, and D can all be answered with a yes or a no. Question C is most likely to encourage conversation, most likely to get the resident to talk. All right, these questions are about keeping the resident safe. Let's look at some examples. While walking down the hall, a nurse aide looks into a resident's room and sees another nurse aide hitting a resident. The nurse aide is expected to A, contact the state agency that inspects the nursing facility. B, enter the room immediately to provide for the resident's safety. C, wait to confront the nurse aide when he or she leaves the resident's room. D, check the resident for any signs of injury after the nurse aide leaves the room. Correct answer is B. Enter the room immediately to provide for the resident's safety. Okay, a CNA will follow the plan. So on the test, you want to look for answers that say carry out the care plan, follow the care plan, follow the blank as described in the care plan, or follow the schedule. When in doubt, follow the plan. Let's look at this question here. A resident is on a bladder retraining program. The nurse aide can expect the resident to A, have a fluid intake restriction to prevent sudden urges to urinate. B, wear an incontinent brief in case of an accident. C, have an indwelling urinary catheter. Or D, have a schedule for toileting. Correct answer is D, have a schedule for toileting. When helping a resident transfer from a bed to a chair, which of the following best demonstrate appropriate safety technique? A, place a gait belt around the resident's waist. B, position the chair as close to the bed as possible. C, signal the resident to stand by saying 1, 2, 3, stand. D, follow the transfer technique as described in the care plan. You will see questions like this. The correct answer is you will see questions like this on the state exam. Not all residents will need the same thing. So when we transfer from a bed to a chair, we need to follow the plan. Some residents may need a gait belt. Some residents may need a mechanical lift. We don't know, but we do know that we always follow the transfer technique as described in the care plan. Best answer is D. A resident who is admitted today is sitting in a chair in his room. He asks for help to go to the bathroom. The nurse aide knows the resident's care plan has not been completed. To help the resident, the nurse aide should A, ask the resident to use a walker while assisting the resident to the restroom. B, get another nurse aide's help to walk the resident to the bathroom. C, ask the charge nurse for instructions on what assistance the resident needs. Or D, take the resident to the restroom in a wheelchair. The correct answer is C. Like the previous question, we don't have enough information. We don't know if the resident needs a walker. We don't know if the resident needs 2 nurse aides. We don't know if the resident needs a wheelchair. This is a new resident. We need to ask the charge nurse for instructions on what assistance the resident needs. A nurse aid's role in assisting with a bowel and bladder retraining program includes A. Being consistent with carrying out the toileting schedule. B. Notifying the family that the resident has been placed on the program. C. Determining the type of program best suited for the resident. Or D. Checking the resident every 4 hours for incontinence. And the correct answer is A. Being consistent with carrying out the toileting schedule. A resident's care plan provides the nurse aide with information about A. The financial arrangements made for the resident's care. B. Specific care required for the resident and the goals of care. C. Facility procedures for performing different nursing care procedures. D. The nurse aide's assignments and when care is provided to each resident. And the correct answer is B. Specific care required for the resident and the goals of care. So the resident's care plan is about the resident and the goals of care. All right, on the state exam, you will see questions where you need to report changes. Report changes in the resident, and you also need to recognize critical situations. Changes you should look for these phrases. A resident usually, but, a resident who used to, but. When you see these, you know that you need to call the nurse immediately. So let's look at some examples. Okay, a resident usually responds verbally to the nurse aide's greetings, but this morning, the resident seems to be having trouble waking up. The resident is not talking and is warm. The nurse aide's next action should be to A. Try to wake the resident again in a few minutes. B. Speak louder to make sure the resident can hear. C. Wipe the resident's face with a cool washcloth. Or D. Call for the charge nurse immediately. Correct answer is call for the charge nurse immediately. The resident usually responds, today the resident is having trouble waking up. This needs to be reported to the nurse immediately. A resident who used to go to the bathroom by herself now asks for assistance to walk to the bathroom. What is the appropriate response by the nurse aide? A. Assist the resident and report the change to the charge nurse. B. Understand that these changes are a normal part of aging. C. Update the resident's care plan and explain the change to the charge nurse. Or D. Encourage independence and suggest that the resident try going to the bathroom on her own. Correct answer is A. Assist the resident and report the change to the charge nurse. All right, next question. Which of the following should be reported to the charge nurse immediately? A. A resident's change in appetite. B. A resident's complaint of chest pain. C. A resident who refused to take a scheduled tub bath. Or D. A resident who wanders is found napping in another resident's bed. Chest pain. Chest pain needs to be reported immediately. Correct answer is B. A resident's complaint of chest pain. A resident who is usually alert and oriented is having difficulty remembering where he is today. What should the nurse aide do first? A. Increase the resident's fluids, since dehydration causes confusion. B. Consider that some memory loss is a normal part of aging. C. Ask where the resident believes he is. Or D. Report the change to the charge nurse. Correct answer is D. It's a change in the resident. We report the change to the charge nurse. Considering the resident's activity, which of the following sets of vital signs should be reported to the charge nurse immediately? Let's look at each of these. Resting, 98.6 degrees, 98.32. After eating, 97 degrees, 64.24. After walking exercise, 98.2 degrees, 98.28. While watching television, 98.8 degrees, 72.14. Which of these should be reported immediately? The correct answer is resting, and let's look at why. 98.6 degrees is normal. 98, this column right here, this is the pulse rate. The pulse rate is normal, but here we have respirations. This resident has 32 respirations per minute. Normal is 12 to 20, and this resident is resting. They are breathing very fast. Needs to be reported to the charge nurse immediately. All right, always report changes in color. Always report swelling. When bathing a resident, the nurse aide observes that the resident's great toe is red and swollen. Which of the following is the appropriate action by the nurse aide? A. Protect the toe by putting on an extra sock. B. Report the observation to the charge nurse. C. Apply an antibiotic ointment to prevent infection. D. Soak the foot in warm water and dry gently. Correct answer is B. Report the observation to the charge nurse.